Welcome to my channel, Dr. Ho.
Thank you. Nice to be here with you, Nadia.
Yeah, I'm excited about learning more about macular degeneration. I was wondering if you could tell us what it is for people that don't know about it and what's the difference between dry and wet macular degeneration.
Sure. Macular degeneration is an aging condition of the eye. It's typically called age-related macular degeneration, and there are two types. The macula is the focus point of the eye. So think of the eye as like a camera with a lens up front and then film in the back. The film is called the retina. Many people have heard of retina. The lens up front can get cloudy. That's called a cataract, and you can have cataract surgery. We're talking about the film or the retina. Now, macula refers to the focus point of the retina. So you can have aging in the retina, specifically the macula, the focus point where you read, see someone's face, and that's called age-related macular degeneration. It's very, very common. In fact, it's the leading cause of significant vision loss in this country, in the United States, and most developed countries around the world. And there are two types of macular degeneration, a dry type and a wet type. And the wet type implies, as you might imagine, leakage and bleeding, and we have treatments for that. They involve medicines that we treat the eye with. And the dry type is an aging condition, kind of like I almost tell my patients is as common as gray hair and wrinkles. There's more of a predilection among Caucasians than Asians than African Americans, but it's a prevalent, common age-related eye condition. Most people will not go blind. Most people will not suffer severe vision loss, but it's like most conditions, if it's diagnosed early and monitored early, you can do better over time.
So it's really age-related then?
That's right. It's age-related.
Predominantly in the Caucasian population?
Predominantly, but not exclusively. That's correct.
What's the age typically when someone gets diagnosed? Is it 40, 50, 60?
We define it at age 50 and older, and it's a significant portion of our population as all the baby boomers get into their 60s and 70s and 80s and beyond. And the baby boomers and the senior segment are the fastest growing segment of the U.S. population. That's why it's a very important public health issue.
And that's the largest group demographically, that's why, correct?
Absolutely.
Largest aging group, I should say.
The aging group, right. So 50 and older is how we typically define it.
And so how is this impacting people with the pandemic? I would imagine, like I know for me personally, I'm avoiding all doctor appointments right now until January if I can wait, or until there's some kind of news where it's safe to be out in the public.
Right. So in the wake of the pandemic, particularly among this population age group, the seniors, we can understand the concerns and reluctance to go to see a doctor. On the other hand, I would say that eye doctors, retina specialists like myself, have modified their waiting rooms, their protocols, everyone's masked, screened, temperature checked, spaced out in the waiting room, so that it is, in general, a very safe environment. I would encourage patients that are having vision symptoms not to be afraid going to visit their eye doctor. It's really important to catch disease early. Vision is really important to your quality of life. So although you may have concerns, go to the website of the eye care professional that you see, and you'll often see the environment and how it's changed.
What are the symptoms of macular degeneration? How does somebody know they have it?
You can't tell based on symptoms if you have macular degeneration or not, because blurry vision, which is a symptom of macular degeneration, distorted vision, wavy vision, can be due to a number of things. And that's why you have to get evaluated and checked. So if you have symptoms, please get checked by an eye care professional. Even in the pandemic, as I said, there are much more safety considerations for patients. The symptoms of macular degeneration can be none. They can involve some blurring of vision, some fluctuating vision. Dr. Ho, it takes me a long time when I go from a light room to a dark room, or a dark room to a light room, or just like everyone, the TV is not quite as clear. No one can see the scroll on the bottom of the TV, but, worsening vision in that regard, distorted vision, those are all potential symptoms, or sudden vision loss. Pain is not a characteristic. A red eye is not a characteristic of vision-threatening age-related macular degeneration.
So how do you know the difference between the example that you just gave when you go into a dark room? How do you know you don't have a visual impairment in terms of dark rooms as opposed to macular degeneration? How would you discern? that?
Yeah, a patient can't discern based on symptoms if they simply have aging eyes or cataract or the need for new glasses or age-related macular degeneration. Hence, prioritizing your vision. Actually, the Surgeon General just came on yesterday with a Twitter announcement. Please don't forget your eye exam, your annual eye exam, because vision loss is often preventable, whether it's in macular degeneration that's progressed or not, or diabetic retinopathy, the other major threat to people's vision, a growing threat, especially in this country and other places around the world. Get your eyes checked.
And what is the treatment for macular degeneration for people?
I tell my patients it's tough to slow down aging,
Right.
but basic healthy principles apply. Good diet, eat a lot of colors of fruits and vegetables, eat fish like tuna and salmon, exercise, 30 minutes of walking daily, good for your body, good for your spirits, good in a pandemic, safe and socially distanced, control your blood pressure. And in the appropriate patients with dry macular degeneration, we do recommend vitamins, specific eye vitamins that can help slow down progression. So a foundation of healthy habits and diet, regular eye exams and monitoring, and potentially eye vitamins are the way to slow down the dry form of macular degeneration, the earlier form. In terms of the wet form of macular degeneration, our treatments involve monthly injections, and we give numbing drops, and patients get a tiny pinch into their eye on the side, on the white part, and those injections have been basically miraculous ways to preserve and save vision and prevent blindness. We never shut down when COVID was really bad. Retina specialists around the world in the United States continued to be essentially frontline responders because vision is so important, and we needed to be there for patients that required injections to save and preserve vision.
Let me ask you, is exercise a component of that you're getting your blood flowing and that's good for your eye? Is that why exercise is good for you?
Yeah, I think there are a variety of reasons. Exercise itself, blood flow, indirect effects on cardiovascular risk reduction, blood pressure monitoring and reduction with exercise. All those things come into play. We know that patients with cardiovascular risk factors are at increased risk for macular degeneration, vision loss, or diabetic retinopathy associated vision loss. So those healthy habits, I think, are not only good for your spirits, but good for your body and for your eyes and for your quality of life, since your eyes are so important to reading, driving, seeing your grandchildren, working, computer, quality of life. Prioritize your eyes. Get your eyes checked.
And a couple of questions. Which vitamins are good vitamins? Because there are lots of different eye vitamins on the market. And secondly, what do the vitamins do? I mean, are they antioxidants? What are they preventing from the progression of macular degeneration?
There are specific eye vitamins for age-related macular degeneration, and they do involve antioxidants and zinc and vitamin C and vitamin E and carotenoids like lutein and zeaxanthin and copper micronutrients. So these are specific vitamins that are recommended for certain types of macular degeneration. If you have very, very early, then the vitamins probably don't do much. If you have middle stages, then yes, they can slow things down. But just a healthy diet and good, healthy lifestyle is what we're emphasizing for many people, regardless of macular degeneration.
Right. That's good for health overall. Any last comments you'd like to make for people with macular degeneration, or in terms of, I think we talked about who might be vulnerable to it, that they should go ahead, not to be scared to go see a healthcare professional because now you have all these protocols in the waiting room.
Right, get your eyes examined, that's important. Who's at risk? Patients, I get the question all the time. My mother has macular degeneration. She's getting injections. Is that my destiny? It's not necessarily your destiny to get, if it's family history, yes, is one factor, but if someone in your family, if a parent has macular degeneration, it doesn't mean it's your destiny. Perhaps the most modifiable and important factor in terms of severity of macular degeneration or diabetic retinopathy, the other major retinal cause of vision loss, is smoking. I've gotten many patients to modify, reduce, quit smoking because they say, wait a second, smoking's going to increase my risk of blindness. I've already lost vision in one eye, my only eye. And then I get people to call 1-800-QUIT-NOW, the national hotline with resources for quitting smoking. We tell patients, if you're smoking 20 a day, a pack a day, hey, let's not go cold turkey because we know you're going to fall back off the wagon. Let's go to 19 a day for a week. And then next week, you're still smoking, but we're going to drop it down 18 a day for the week. And then 17 a day. 20 weeks, when you're a kid, 20 weeks is 5 months. 5 months to the holidays is 1 million miles away. 5 months for you and me and other adults that are at risk for macular degeneration goes by in a second. And because of that, you can leverage vision to change behavior, that is smoking cessation, to reduce risk not only of blindness, but heart attack, stroke, etc. Plus you save money.
With the oxygen, in terms of smoking, is that because you're depleting the oxygen, which kind of impacts the blood flow to the eye? Is that why it's so bad? Or
I think there are a variety of mechanisms that cigarette smoke, nicotine, all the passive other ingredients that are burning in your lungs. Blood flow is one of them. Oxidation and antioxidation is certainly another one. Never mind the carcinogenic effects of cigarette smoking.
Well, we know smoking is bad for you, but I was interested more in the kind of the
Cancer.
biochemical impact on your eye.
Yeah, cancer doesn't often change people's behavior with smoking, but blindness will. Blindness is a major motivator.
Right. Yeah.
And we use that leverage to try and change behavior for the health of the eyes and the patient overall.
Well, I would think it's effective for most people because if you don't have your vision, like you said, you really lose a lot of freedom, basically. You can't drive, you can't move easily, you can't garden, you can't exercise, Or if you do any of that, well, you can't drive, but, well, who knows with the new cars coming out. But good health is a good practice anyway.
It's a good shift as we talk about general health to diabetic retinopathy, since so many people in this country and around the world have diabetes mellitus, and never mind pre-diabetes, and are at risk for, it's the number one cause of vision loss in working age Americans, which is diabetic retinopathy.
My mother had that, by the way. She was a type 2 and had vision loss and diabetes.
All the healthy habits apply to diabetic retinopathy. So what is that? It's diabetic eye disease. It's diabetes affecting the retina, affecting the macula, the focus point of the film in the camera of the retina, causing bleeding and leakage and loss of vision. And honestly, diabetics have more of a challenge coming in for their visits, their eye visits. Why? Because they're working age. I've got work. Or my child is now home from school because of the pandemic and I can't get away. Or I've got to go see my foot doctor. I have to see my primary care doctor. There are competing medical issues. So I would really emphasize that if you have diabetes mellitus, if you know a family member or friend with diabetes mellitus, please encourage them to get their annual eye exams. The eye professional office is a safer environment in the pandemic now than it used to be. It's preventable blindness with diabetic retinopathy is, if we can get to patients and they come in, we can prevent blindness in 90% of patients. Think about that. We have 300 million U.S. citizens, about 330 million. 10%, 33 million have diabetes. Among those, a third to 40% have diabetic retinopathy, and many don't know it. And if we can get to them, we can prevent blindness. There are new medicines, many of the same injections, laser treatment, surgery. It's that they often come in too late, and they walk in like a bomb has blown off in their eyes. So please encourage, it's the healthy habits that we were talking about, blood pressure, exercise, blood sugar, A1C level, but it really is getting in for the eye exam that will help reduce blindness rates. So that's my take home. If I could have one take home message for this audience, it would be that vision is so important to your quality of life that you need to prioritize getting your eyes checked, even in light of all competing factors like work, other medical appointments, the pandemic. Please, please, please come in and get your eyes evaluated. Just to come in, and many will have okay exams and see you next year, but others will detect and prevent blindness.
Right. Well, thank you for that information. And I definitely will make my eye appointment now, knowing that there are new protocols in place. We're so used to being sheltered inside that, there's so many fears about going out, even shopping or doing anything anything, just because the COVID is airborne. But thank you very much. I find that really helpful, and I'm sure our viewers will also will encourage them to get out there and get their eye tested.
Yeah, the eye exam is important. It's not just getting checked for glasses. You need drops to dilate your eyes, to look in the back at the retina. A full eye exam with an eye care doctor is important. And I'm a retina specialist at Wills Eye Hospital, and we take care of the routine to the complex. And it really is the tragedy is when the 30-year-old diabetic comes in and says, "I just didn't know I had a problem," and one eye blows up with bleeding and loss of vision, and the other eye is on the edge of a cliff. So prevention
goes a long way.
Please, yeah.
All right. Well, thank you once again.
Okay, thank you very much. It's nice to be with you, and congratulations on your very, very popular media outlets.
Thank you. From Diabetes Health, I'm Nadia Al-Samri.